Residents of 4 states are on edge this morning with fresh COVID cases emerging in Victoria and Western Australia, while there are warnings the situation could deteriorate further in New South Wales and Queensland. In Sydney, the Premier has given a grim assessment of the country's largest and most stubborn COVID outbreak, saying numbers could get even worse. The death of a previously healthy 27-year-old with COVID-19 has shocked the city. On a day, 233 new cases were recorded. The outbreak linked to several Brisbane schools now stands at 63 cases, with the state's chief health officer saying it'll be a challenge to lift restrictions as scheduled on Sunday.
Further south, health authorities in Melbourne have been working overnight to trace the movements of a teacher at Al-Taqwa College in the western suburbs, the site of a major cluster last year. And WA is this morning resisting a lockdown at this stage after a fly-in, fly-out worker returned a week positive. A lot going on around the country this morning. So let's bring in Nakari Thorpe in Sydney, Jess Rendell in Brisbane and Talia Olatia in Melbourne. Good morning, all of you. Kicking off with you, Nakari, what is the latest in Sydney this morning?
Good morning, Michael. Yeah, well, we heard the tragic news of 27-year-old Auday Alaska, who died in his home in Sydney's southwest on Tuesday. He was on day 13 of home isolation when he, after testing positive to COVID-19, and he died suddenly, collapsed in his unit. He was found by his wife, who's also contracted the virus and is now in hospital. His condition was being monitored on a daily basis from staff from the area's local health district. But the New South Wales Chief Health Officer, Dr. Kerry Chant, said that he deteriorated suddenly. Of course, his death has come as a shock to his family and friends, who say that he was a healthy, fit young man with no underlying conditions, but he was unvaccinated. And now he's become Sydney's youngest COVID-19 victim. We also heard yesterday the death of a woman in her 80s who died at Sydney's Royal Prince Alfred Hospital. She too was unvaccinated. It now brings the state's total death toll to 73 since the beginning of this pandemic. Health authorities say the death of Mr. Alaska is a very sobering reminder of just how dangerous this Delta variant can be, particularly for young people. And it comes as New South Wales recorded 233 new cases yesterday. Now, of those, 92 were isolating at home, 21 were isolating for some time, 47 were fully infectious in the community, while the status of 73 remains unknown. Now, Gladys Berejiklian said this growing number of cases in the community show just how this outbreak is really only going to get worse. It hasn't reached its peak just yet. And now it's also thrown doubt over when Year 12 students will return to face-to-face learning. It was scheduled for August the 16th, but the state government is now urgently trying to come up with an alternative plan, which is looking like very likely it'll have different approaches for different parts of Greater Sydney.
Nakari, thank you. Talia in Melbourne. So what do we know about the latest case in Victoria?
Good morning, Michael. Yeah, so yesterday the hopes of a donut day were dashed by the afternoon because of this positive COVID case. What we know, it's a woman in her 20s who is a teacher at the Al-Taqwa College here in Truganina in Melbourne's west. And you really have to feel for this school community, given, you know, the massive outbreak that they saw last year. It does mean, though, that they know what to do. So the site now is a Tier 1 site, which means all 2,100 students and 300 staff members are required to get testing. And last night at the testing site at the showgrounds, it opened until 8 o'clock with dedicated lanes so that the community college here could go and get tested. They are now required to isolate for the next 14 days. That's staff and students, as well as members of their households. Now, authorities are treating this woman as being infectious from last Wednesday, which means that a Coles in Yarraville is considered a Tier 2 site. It happened on Thursday between 4:30 and 5:30, which means if you were shopping there, you are encouraged to go and get tested and to isolate until you provide a negative result. Of course, like I said, the school knows what to do and they are taking all the precautions necessary with the support from authorities. But college spokesperson Terry Barnes is reassuring the school community and I think really the state at large that it is just the one case at the moment.
The school went through a tough time last year with the COVID, but has learned from its experiences. And really, we're talking about one case here, and people do understand that. And certainly, the school is working very hard to reassure its staff and reassure its students and families that everything that can be done is being done.
So as you can hear there, the school are doing all that they can to ensure that, the virus doesn't spread, and if it does, it can be managed. We'll still have to wait and see what this case might mean for the easing of the restrictions, which were scheduled for next week.
Talia, yes, lots of fingers crossed across Victoria. Thank you. Jessica in Brisbane. What's happening there with the vaccination rates?
Good morning, Michael. Well, health experts have warned that they are concerned about the low rates of vaccination in local government areas outside of Brisbane. We know that in Logan, only 30% of the population are fully vaccinated. That goes up a little in Ipswich. That's 16% there. That's compared to around 24.5% here in Brisbane. I'm outside a vaccination clinic now at the Mater Private Hospital. We do know that the experts are saying that there needs to be more of a community-based approach to the vaccination rollout. So getting community leaders involved. There are a lot of multicultural communities in those areas of Logan and Ipswich as well. So they're saying that that could help bolster our vaccination rates, especially while we're going through this outbreak as well. Now, we know that we're expecting 150 extra doses of AstraZeneca this week, and that's being distributed to pharmacies as well. So to ease that access point, so more people can go out, walk up to their pharmacies and hopefully get a vaccination. Yesterday, our health minister said that she's written to the Commonwealth to ask for our 85,000 doses of Pfizer to be brought forward so that we can get through this outbreak and vaccinate as many people as possible. Now, we know that at St Joseph's Gregory Terrace, it's a college here in Brisbane, there could be some potential cases coming out of that today. That's because a student from Brisbane Grammar School who played a rugby match on Saturday has since tested positive. So any students at St Joseph's Gregory Terrace will need to now isolate for 14 days and get tested as well as any of their friends and family. Now, the student also watched another match after his own game, so any players in that match as well as their friends and family will have to get tested and isolate for 14 days. We know that rugby is a contact sport, so we could see some cases come out of that match as well in the press conference today.
OK, all eyes on that one too. Jessica, Talia and Akari, thank you all for the updates. Meanwhile, results are pending for close contacts of a Perth fly-in, fly-out worker who returned a weak positive COVID test. The man was at Perth Airport on July the 20th at the same time as a positive Queensland case. He then spent a week at a mine site in the Pilbara. Now, he returned a negative result after a second test, but could have been infectious while out in the community. The Premier says there is confusion around the case because the worker also had COVID in March last year.
We don't know if he's actually what's called a shedder of the virus now, although that is unlikely. And we don't actually know that he acquired it from the gentleman at the airport on the 20th of July, but that is the most plausible explanation we currently have.
2 Victorian men will appear in a South Australian court today accused of failing to comply with COVID directions at a quarantine hotel. It'll be alleged the men were not wearing masks and failed to return to their rooms when directed.
Global coronavirus cases have now passed 200 million as the Delta variant threatens areas with low vaccination rates. Cases are rising in at least 83 countries. It took more than a year for COVID-19 cases to hit the 100 million mark, but the next 100 million have been reported in a little over 6 months.
Let's have a look now at where Australia stands with its vaccine rollout. The number of those fully vaccinated is 20.2%. Now, a first dose, it is 41.9%.
Thank you, Lisa. Let's return to Sydney's COVID outbreak and the death of that 27-year-old man. Ord, Alaska, had no underlying health conditions. He died at his home after battling the virus for about 13 days. His cousin has spoken with the ABC and says he was his best friend.
I was on the phone with him before he passes away in about 10 minutes or 15. And he said that he's okay now and he's feeling better. And He said that I'm going to go have a shower, guys, and I'll call you back. So he went to the shower, and then after that, his heart just stopped. He was a healthy person. He was a soccer player. Everyone loved him. He was such a nice fella. All the community loves him. We're still in shock. We can't believe actually what's happening. He called the hospital when he had some pain in his head and he wasn't feeling well. They didn't even show up. He's just an amazing person. He didn't have trouble with anyone. Everyone loves him. One day, he was sitting down before he gets engaged. He said, "Bash, you know what I do. If I get married, you're going to be my bridesmaid. And if you get married, I'll be your bridesmaid too." And he broke the promise. And he left too early.
27 years old. OK, staying in Sydney, residents at a third apartment block in the city's southwest are in a 14-day lockdown with 9 COVID cases confirmed so far. Many at the complex in Campbelltown say they were taken by surprise with emails raising the alarm and no deliveries of food or essentials permitted. Pauline Tuamasanga is among those in lockdown with her husband and 4 sons. She joins us now. Pauline, a very good morning to you.
Good morning. How are you?
I'm very well, but more importantly, how are you? How's your husband? How are your boys?
Look, considering the circumstances, we're very, very good, to be honest. You know, as I said to one of your guys from yesterday, we were actually prepared for this. Unlike some of our neighbours, we had already sort of thinking, okay, this may be longer than what we anticipated. So we were able to actually purchase, groceries that would last us for about a month. So, yeah, the unfortunate thing is that some of our neighbours may not have had the opportunity to do that. So we're fortunate we did.
That's great to hear about your circumstance. I just want to ask you, and it includes your neighbours, obviously, when did you all get the directive that you had to stay at home for 14 days?
No one really told us, to be honest. It wasn't until yesterday. We got up and we came and had a look outside and noticed that the police officers were still there. But we still weren't given any kind of notice whether we're staying in for the next 14 days. But they came early in the morning and said that the whole apartment building was going to get tested. And so our whole family got tested. And then it wasn't until later on in the afternoon that we finally had the New South Wales Health Services come to our door and tell us that it looks like we're going to be here in the bubble for 14 days. And that's the only information that we've been given. We haven't heard from anyone since.
OK, so what is your view on how the Health Department, New South Wales Government has handled the communications with your family, Pauline, and for that matter, everyone else living in that apartment complex?
Look, under these circumstances, it's understandable, but it would be nice because, a lot of people, they have to go out to work, and we're stuck here. Even though we've been tested negative, we're still stuck here. So I think it could have been done a little bit better, but I'm choosing to look at the positive side of things.
Now, you're a disability care worker. You have 5 clients, I believe. Obviously, you're missing caring for them. How are they being looked after, as far as you know?
From what I understand, we still have staff that are working there, but I do really, really miss being at work at the moment. And, as I mentioned before, to one of you guys that called yesterday, we actually have a few clients, well, not for the organisation that I work with, but there are other clients that do live within the building. And the sad thing about that is they access the park that's right across the street for community access. And so they haven't been able to actually go out for community access because of the lockdown. So I can only imagine how that's affecting their mental state. So, back to your original question, I do miss being at work and supporting my clients. So
you got 14 days in lockdown in your apartment. Are you looking forward to that? Have you got strategies for you and your husband and boys to cope?
Oh, most definitely. Most definitely. I think we'll be all right. Yeah, but we don't even know whether it was from yesterday or whether it was from the day before. I don't know when the end date is. So of the 14-day period, sorry.
OK. Well, listen, Pauline, thank you so much for taking the time to have a chat to us. We wish you, your husband and your boys all the best for what's going to be a trying time for the next 14 days and appreciate your insights from the ground there. Thank you so much. You take care. You too. Now, in the UK, Their vaccine rollout is kicking up another notch, with 16 and 17-year-olds to be offered their first dose of the Pfizer vaccine before schools come back in September. Our Europe correspondent Nick Dole has more from London.
The government's vaccine advisors only a couple of weeks ago were saying that they were still concerned about the rare risks of some heart inflammation that had been seen among young recipients of the Pfizer vaccine. But now they say they've had more time to look at the data, and they're confident that those risks are very small, and also that they are outweighed by the positives. Now, of course, when you think about positives with vaccines, reducing the risk of serious illness and death is obviously key. But for young people, particularly teenagers, that's a pretty low risk anyway. So health experts here have been looking at the other sorts of benefits of vaccinations, things like reducing the risk of long COVID for young people and reducing the risk of their schooling being disrupted as well. So the UK is certainly not the first country to do this. Italy, France, the Netherlands, Israel and also the United States, they're all vaccinating younger people.
And Nick, I'm paying very close attention to what's going on there after so-called Freedom Day. Infection rates there are continuing to defy all predictions. That's right, Michael. It was about this time a fortnight ago when so-called Freedom Day had just been declared and Boris Johnson had scrapped the laws surrounding things like wearing masks and social distancing. There were a lot of predictions, including from within government, that cases could hit as much as 100,000 a day. Well, they haven't. Today, they were about 29,000, and those numbers have been quite clearly trending down for more than a week now. So there's a range of reasons why this might be happening. Potential factors could be things like the football finals being over, the school term being over. Anecdotally, people may be somewhat reluctant now to get tested, but certainly health experts here say that it's a really encouraging sign that the vaccines are doing their job, not only at cutting down hospitalisations, but cutting down the risk of transmission as well.